we'll discuss another question from NEET 2025 previous year question cardiology. So again, read the last line, which is the next best test. So some diagnosis has to be picked up and we have to think what is the next level. A 70-year-old man underwent joint replacement surgery 3 days ago. Today he developed sudden onset breathing difficulty with chest pain. On examination, pulse rate was 110 per minute. So there is tachycardia. BP was 90/60. So looks like a hypotension. Respiratory rate was 28 per minute. The normal respiratory rate, when respiratory rate is more than 20, it is called as tachypnea. Respiratory rate less than 10, it is called as bradypnea. Opioid poisoning is an example for a drug causing bradypnea. The triad of pinpoint pupils, bradypnea and drowsiness is an example for bradypnea. Here we have tachypnea. Just an add-on I told you for because it may be asked as a question. Opioid is important. Okay, and SpO2 was 86% in room air. So there is hypoxia. Right? So patient comes with breathing difficulty with these features. So there are so many diagnoses which can cause this, but we have to pick up some clues. ECG shows sinus tachycardia. So what may be the best possibility? Some people may give an extra clue here in the question itself, like D dimer was high. Actually, the question given in NEET was D dimer was high. I didn't mention it here because I just wanted you to think what may be the possible diagnosis. So there are many conditions which cause sudden onset breathing difficulty, like bronchial asthma acute exacerbation, COPD acute exacerbation. It could be a pneumonia. It could be a pneumothorax. Whenever there's a breathing difficulty, try to find out the clue, clinical clue. Right? For example, a patient with a known bronchial asthma comes with a wheeze. When the climate is cold, it may be bronchial asthma. When a smoker comes with breathing difficulty, it may be COPD. Right? When patient comes with fever and breathing difficulty and these findings, it could be a pneumonia. When a patient comes with chest pain and breathing difficulty, it could be a pulmonary edema of a myocardial infarction. Here, the clinical clue itself picks up. There is a history of joint replacement surgery. When there is a joint replacement surgery, patients has to take bed rest. When someone takes a bed rest, they are more prone to form deep vein thrombosis in the leg veins. So you know the triad, right? Hypercoagulability, stagnant blood, and endothelial injury. The Virchow's triad, when it is there is more chance of thrombus formation. So when patients take rest, there is obviously a stagnation of blood there. So it can lead to DVT. When DVT follows the track, that is when from the veins it goes into the IVC and SVC join to form the right atrium. The blood from the right atrium goes to the right ventricle. You know very well that pulmonary artery, the main pulmonary artery, begins from the right ventricle. The main pulmonary artery divides into two branches, which is right pulmonary artery and left pulmonary artery. So even though there is a vein thrombosis which is forming in the leg veins, through IVC, through right atrium, through right ventricle, through pulmonary artery, it can block one of these pulmonary arteries. So when the pulmonary artery is blocked, what happens? The blood from the ventricle cannot be pumped into the lungs. When blood is not pumped into the lungs, what happens? Even though the lung is ventilated with the air, since the perfusion of blood is not there in the lung, there occurs a mechanism called VQ mismatch, ventilation perfusion mismatch. So blood is not flowing, the perfused blood, oxygenation of blood is affected, so this leads to hypoxia. Right? This is how pulmonary embolism, by blocking blood flow to the pulmonary artery, reduces blood flow to the lungs, reduces the perfusion, and hence causes VQ mismatch leading to hypoxia. In pulmonary embolism, D dimer is high. Remember, D-dimer is one of the fibrin degradation products in clotting mechanism, right? So given the clinical clue of history of a joint replacement surgery and a bed rest with sudden onset breathing difficulty, clinically this looks like a pulmonary embolism. The most common, this is also an MCQ, the most common ECG finding in pulmonary embolism is sinus tachycardia, which is given here. The heart rate will be very high, more than 100. But we have another question. The most specific or the most characteristic finding of ECG in pulmonary embolism is S1 Q3 T3 pattern. S1 is in lead 1, there is S wave. Q3 is in lead 3, there is Q wave. And T3 is in lead V3, there is T wave inversion. Okay, so this is the most specific finding of pulmonary embolism, S1 Q3 T3. But since now NEET questions are becoming more clinical, it is more likely that you may get a question of sinus tachycardia alone, because the most common ECG finding in pulmonary embolism is sinus tachycardia. So the actual question in NEET was, they are given the clue directly, D-dimer was high, so the diagnosis is pulmonary embolism. What is the next best test? So we'll read the options. VQ scan is ventilation perfusion scan. I already told you in pulmonary embolism, the mechanism is because of pulmonary artery blockage, there is a ventilation perfusion mismatch. Previously there was a scan to find out that, but it is outdated. So even though most books, old references say VQ scan, do not answer this in NEET. It is an outdated test, right? Echocardiogram. Obviously, we will be doing echocardiogram because when ECG showing abnormality, echo will be done. Echo can pick up some findings in pulmonary embolism like a dilated right atrium, dilated right ventricle, but we'll read the other options. Chest X-ray also can show few findings in pulmonary embolism. Chest X-ray also can pick up, but it is not the investigation of choice. CTPA, CT pulmonary angiography, it is the investigation of choice. It is the next investigation of choice, and it is also the gold standard. So however they ask you the question, CTPA is the test of diagnosis, right? CTPA is pulmonary angiography. We are injecting a dye into the blood and we are imaging the lungs. So when the blood is blocked in the pulmonary artery, it can be picked up. Okay. So we have discussed 5 questions in NEET previous year question on the Department of Cardiology from Medicine. So in the next session, we will discuss another 5 questions from another section. Thank you.